Hello everyone, my name is Ray and I'm a Chinese vet. I work for IVC Veterinary Hospital and my interest is in anesthesia. So today I just want to share some of my experience with you guys and let's see if there's anything new for you or if there's any new knowledge for me for patient assessment. These two pictures are from my hospital. The first one is our reception area, and the second one, of course, this is one of our surgical theater. And we can see the anesthetic machine and the monitor and the beer hugger, everything like that. Um, yeah, I wish I can see you guys someday, probably in China. If you guys visit China, please come to our hospital and we can learn from each other and have a good time. So let's talk about animal assessment before anesthesia. First thing we need to discuss is the ASA scale system. I know everyone using ASA scale system because it is just so useful. The reason why it has been widely used all over the world is because it gave you a level 1 to level 5, sometimes with a level E, which is emergency system. It just make everything easier for us and for clients to understand if the patient's anesthetic risk is high or not. We can see there are two pictures on the slide. One of them is the original ASA scale system and the other is slightly modified. For our hospital, we've been using the scale system with the emergency level. It makes things much easier for us, and also for nurses to understand the patient's risk level because it gives you a precise description of the patient, how you scale the patient, and the disease, like the examples for different levels of the patient. For level 3, the patient may have controlled diabetes, and for level 4, the patient may have sepsis, organ failure, or heart failure. The other one, from the other picture, we can see instead of giving you a certain disease, it gives you a symptom. Sometimes it's a fever, like the level, still for level 3, the patient with severe systemic disease, it will give you a symptom like fever, dehydration, anemia. So I think this ASA scale system, it doesn't matter which modified version you are using, as long as it helps you and make it easier for your work, you just keep using it. The thing that I will talk about today is how we make a accurate ASA scale. Like, how do we get all those informations? We can say, okay, this patient is level 3 anesthetic risk. The ASA scale is level 3. Okay, what informations we need to get to support our idea? This is very important. How do we achieve pre-anesthetic assessment? In our hospital, we normally run things in this order. We first take information from the patient, which is signalment plus history. We run physical exams on our patient. We collect diagnostic data. Sometimes we run blood works. Sometimes we get blood results from other hospital. And the thing that most of us overlook is the procedure that we do to our patient. Some of them is MRI, it's non-invasive, and some of them surgeries, especially orthopedic surgeries, emergency surgeries. Sometimes those invasive surgeries can actually increase the risk level of the patient. So let's talk about the signalment. It includes species, breed, age, and body condition score of the patient. There are more information about signalment, and here are just 4 examples. Well, let's talk about the species and breed. Different species, especially dogs and cats, that's the most common species that we treat here in China in small animal hospital. I think, yeah, in a lot of places in the world, we have rabbits, lizard, and other exotic animals in hospital, but that's not normally what we see here. Just talk about feline patients and canine patients. They are quite different. Cats have narrower airway opening and can easily get laryngeal spasm, and the dogs have wider and bigger airway opening.